Hi guys, I'm Bec. I'm an oral health therapist at Floss, and I wanted to jump on and chat to you about traditional fillings and stainless steel crowns for baby teeth. Stainless steel crowns are amazing. They're becoming more and more popular. You'll start to see a lot more kids running around school with these silver jewelry teeth in their mouth. They are the best. It's very rare that you'll find us doing a traditional filling on a baby tooth over a stainless steel crown. So if you can imagine, a traditional filling normally involves having to numb the tooth up. So there's a needle, they'll have a numb face for a couple of hours. The appointment can take anywhere between 40-50 an hour, and in that time your child has to keep their mouth open for that whole time. When we're doing a filling, it's important that there's no moisture, no saliva. Even the slightest bit of movement can affect the longevity of the filling, which is why most of the time they have to be replaced before the tooth falls out naturally. There's two ways to do stainless steel crowns. One way does involve a needle and there is drilling. Their mouth does have to stay open, but we don't have to keep the mouth dry. It can just go on with moisture and saliva. So it is a bit easier than filling. The other way that we love to do stainless steel crowns is called the Hall technique. So it's the most minimally invasive. There's no needle, no drilling, no water, and they have to only keep their mouth open for a couple of minutes at a time. On the first appointment, we find the decay, we tell you we've got to do something. If we choose to do the stainless steel crown, this is what we would normally do. So we pop some silver fluoride, which is a desensitizing agent, on the tooth. This helps stop progression of decay, reduces the amount of discomfort and sensitivity that they're getting. And then how we make it so that we don't have to do any needle or drilling is we place some separator bands in between the teeth. So orthodontists use these to naturally push the teeth apart before they do braces or things like that. So we floss the bands in between. It'll feel like they've got food stuck for a couple of days. So we like to leave them at least anywhere between 3 days and 5 days. 3 to 5 days later, you come back to see us. We flick the bands out, make sure the crown fits, put it in place first, and then we put some glue in the crown and just seat it over the tooth. And that's pretty much it. Your child even helps us seat it, so it feels like they're involved in the appointment. We get a cotton roll that they bite down onto to seat it in place so that it'll feel normal when they're biting and chewing. So yeah, if you have any questions, or if you want to know more about stainless steel crowns, or if you think that a traditional filling might not be the best option for your child, let us know. Bring them in and we can have a look and see if stainless steel crowns are right for you.